Good afternoon, everyone. For those of you who missed last class, my name is Anna. I'm your instructor. If you need to reach me, you can reach me through the course email, or I've provided my personal email on the course outline. Do remember that I require 24 hours to respond. Okay, so just to review, last class we went over best possible medication history and the purpose and importance of it. So does anybody remember what the purpose of best possible medication history is? Yes, your name?
Trisha.
Go ahead, Trisha.
Well, basically it's a formal process in which healthcare providers work together with patients, families, and care providers to ensure comprehensive medication information is communicated across transitions of care.
Wonderful. Okay, so ultimately our focus is patient care, and we want to ensure the patients are being prescribed the correct medication in accordance to their home medications. Okay, so we will be conducting a best possible medication interview. So I've provided you each with a best possible medication form. So as I interview our patient, Sally Hansen, you will be filling this form out and we will be taking it up next class. Excuse me. Hi. Hi there, my name is Anna. Is this a good time?
Sure.
I'm a technician here at the hospital. Is it okay if we take a few minutes to review any medications you're taking at home?
No problem, sure.
Okay, great. Can I get your name?
It's Sally,
Can you spell that?
Sally,
And your last name?
Hanson, Hanson.
And your date of birth?
Is March 23rd, 1990.
Okay, your age?
26.
Okay. Can I get your height approximately?
5'3".
And were you weighed in before you came in the room?
I was, yeah.
Okay. Do you remember your weight?
I think around 135.
Okay. Can I just check your ID badge?
Sure.
Great. Okay. Any allergies to medication?
Actually, yeah, pencil.
Have you taken penicillin before?
I have, yeah.
And what happened when you took it?
Mostly shortness of breath.
Okay. Have you taken any antibiotics in the last 3 months?
Yeah, I did amoxicillin. Can you know the strength?
Sure.
500 milligrams.
Okay. Do you remember when you took it approximately?
About a month ago. I had a sinus infection.
Okay. And did you finish the complete therapy?
Yeah.
Great. So are there any prescription medications you're taking at home?
There actually is a couple, yes.
Do you have them here with you?
Some of them, but some I left at home because the ambulance took me in a rush, so.
Okay, no problem. Can I see them, please?
Excuse me.
So we'll start with this one. So ranitidine.
Yeah.
So how are you taking it?
I take it, it's 2 times a day or 1 time a day, depending on how I feel.
Okay, so you take 1 to 2 tablets
Every day.
every day. You take them, if you were to take 2, would it be at the same time, or do you take 1 tablet in the morning, 1 tablet at night?
No, I'll take it at the same time.
So 1 to 2 tablets daily. And you take it every day.
Yeah.
Okay, so the doctor wrote for 1 tablet 3 times a day. Is the doctor aware of the change?
Yeah, I told him last week when I saw him, but he didn't get to change it. We didn't get around changing it yet because he told me to finish this
Finish
one
what you
first.
had?
Yeah.
Okay, great. here we have rosuvastatin.
Okay.
So how many of these are you taking?
Just one.
Just one tablet?
Yeah.
And you're taking it one time a day?
Yeah, usually at nighttime
At
before
night?
bed.
Okay. And you're taking it every day?
Yep.
Perfect. Any other medications you're taking prescribed?
I'm on an antidepressant.
Do you know the name of it?
I forgot because he changed it. It used to be Sertraline, but now he changed it.
Okay. And how many of these antidepressants are you taking a day?
So 2 before bed.
So 2 tablets together before bedtime?
Yep.
And you take that every day?
Yes.
So is it the same doctor that prescribed these?
Yep.
So it's Dr. Lamb?
Yep.
Okay. Is it okay if we contact Dr. Lamb to find out?
Yeah, of course.
Great. Any other prescription medication you're taking?
Actually on one for blood pressure.
Do you know the name of that one?
Ramapro.
Do you know the strength?
2.5 milligrams.
Great. And how many are you taking a day?
One. Also before bedtime.
Before bedtime?
Yep.
And you take that every day? Great. Any others?
I'm also on metformin.
Do you know the strength?
Yeah. 150 milligrams.
Okay. And how many do you take a day?
Twice a day.
So you take 1 tablet in the morning and 1 at night?
Yeah.
And you take that every day?
Yep.
Great. Any other medications?
No, that's it.
Okay. So do you use any of the following? First one, any medicated creams or ointments prescribed by your doctor?
Prescribed. He told me to use vitamin E on my scar, but
So vitamin E.
vitamin E cream. And I also use,
So is that something you're applying every day?
yeah,
1 time a day?
one time, yeah.
Okay.
Also Clendoxil gel on my face.
And how often are you using that?
Not every day, usually when I feel a pimple breaking out. Most,
How long have you been using that?
6 months.
Okay. Are you using any inhalers for breathing? No? Any nasal sprays?
Not at the moment, but I did.
How long ago?
About 2 months ago.
Okay. What's the name of that one?
I'm not sure, it starts with an M.
And it was prescribed by the doctor?
Yeah.
Okay. It was a Dr. Lamb?
Yes.
So we can ask him. How about any injectable medication? Any insulin? No. Any anti-inflammatory injections? No. Okay. Any eye drops or ear drops prescribed
Recently?
within the last 2 months?
No.
Okay. Any medicated patches for pain, smoking, cessation?
Smoking. I'm trying to quit smoking, so the nicotine patches.
Do you know the strength?
No.
Was it prescribed by your doctor? Okay, we'll ask him. And how often are you using that?
Once.
Once a day?
Yeah.
So do you apply it in the morning and remove it at bedtime?
Yeah,
Okay, and how many cigarettes are you smoking a day?
about, I'd say 10.
10? And since you've started using the patch, has that decreased?
Yes. Yeah, I'd say about 4 now.
Great. Okay, any aspirin you buy over the counter? Daily aspirin, 81 milligrams or 80 milligrams?
I have it. I have gotten it, but I haven't used it. I have used it a couple of times in the last 6 months, but
So when's the last time you took it?
I want to say maybe 3 months ago.
Okay. And was that something your doctor was aware that you stopped?
Yeah.
Okay, right. How How about birth control tablets? Are you using any oral contraceptives?
I was, but we stopped it because I'm actually trying to get pregnant.
Oh, okay. How long ago did you stop?
4 months ago.
Okay. Do you know the name of the medication you were taking?
Tricycline. Whoa.
Okay. Are there any medications your doctor may have recently stopped or changed?
Just that, the birth control, and the, like I mentioned, the antidepressant.
Okay, great. Is there any sample medications your doctor may have given you? No? Okay. Do you take any multivitamins
I do.
over the counter?
Yeah, a few actually.
Do you know the names of them, or do you have them with
I
you?
have 2 of them with me.
Great. So we'll start with the vitamin D. These ones. How many are you taking a day?
One a day.
So you take 1 tablet every day?
Yeah.
At the same time every day?
Give or take a few hours.
Okay. And the vitamin B12.
Yes, that's also once a day.
And you take that every day?
Yeah.
Is that all the vitamins, or?
No, I'm also taking multivitamin, 1 a day multivitamins.
For 1 a day?
Yeah.
And you take that once a day?
Yes. Actually, I have 2 a day.
2 a day? So
Sometimes.
2 together?
Yeah.
Okay. Every day.
Yeah.
Any others? Any calcium, iron?
I was taking iron
You're taking iron?
because my iron levels were low, but
Mhm.
then they were normal, so the doctor said to stop that.
How long ago did you stop?
5 months ago, I would say. Yeah.
Great. And what, do you know the name of the iron supplement you were taking?
Eurofer.
And when you were taking it, how many were you taking a day?
2.
2. So 1 twice a day, or 2 together?
No, 1 twice a day.
1 twice a day. And you stopped how many months ago?
5, I would say.
And the doctor told you to?
Yeah.
Okay. So any other supplements? No? How about anything over the counter for pain?
Pain.
So any
Does muscle
Tylenol,
pain?
Advil, anything you've been taking
Yeah.
for pain? Okay.
Advil.
Advil?
Yeah.
Do you know the strength? Is it
400.
regular strength? The 400 milligram?
Yeah.
And how often do you take that?
Maybe every other day because I get lots of headaches, so I use it for my headaches.
So if you were to use it today, how many would you use in a day?
Probably 4.
So when was the last dose you took of the Advil?
Yesterday.
Yesterday? And how many tablets did you take?
2.
2. What time? Approximately.
Approximately 3 o'clock.
3 o'clock in the afternoon?
Yeah.
Okay. Any other pain medications you're taking over the counter?
No.
No? How about any antacids over the counter?
No.
No? Okay, so we have Dr. Lam as your doctor, and if it's okay with you, I'd like to contact your pharmacy to confirm your antidepressant medication.
Okay.
Okay, is it the same pharmacy you use here? Is it okay if we contact them?
Yeah.
And they'll provide me with Dr. Lam's number. Great, so that concludes our interview. Thank you so much, and I hope you feel better.
Thank you.
Okay, so for homework, you'll be reviewing your interview form. In the meantime, I will be contacting Sally Hansen's pharmacy, and they'll provide us with the medication profile history. Okay, so I'll get that to you next week in class, and we will be transcribing all the information that we've received from Sally Hansen, along with the pharmacy information, and we'll be transcribing it onto Dr. Best Possible Medication order form for the doctor to review. See you next week.